If you want to learn about psychological growth without getting lost in complicated language, you're in the right place. This is the Relational Psych Podcast. I'm your host, Dr. Carly Claney, licensed psychologist and the founder and CEO of Relational Psych. On this show, we learn about the processes and theories behind personal growth. Please keep in mind that this podcast isn't a substitute for therapeutic advice, but we're here to point you in the right direction. Today, I have my guest, Rachel Stapleton. She is a licensed independent clinical social worker in private practice in Issaquah, Washington. She specializes in grief and loss, chronic illness, end of life, anxiety, and couples counseling. Rachel, thank you so much for being here today.
Yes, thank you so much for having me.
Yeah, I know today we're going to be talking about why don't we talk about death, dying, and grief more? And I'd love to hear a little bit about that, of framing out this conversation. Where do we get started?
Sure. Yeah. So I think for me, where I got started with it was, of course, when most things start with like my own personal experience, feeling what a lot of grieving people feel, or a lot of people feel around the subject of death and dying. Sort of some unwelcome responses,
Mm.
right? Kind of like really being able to sense, okay, this is making people uncomfortable,
Your
which
own
is,
feelings of grief making others
which,
uncomfortable?
yeah, which that's off a couple other things, like a people pleasing background, but being able to sense early on, oh, here are the things we talk about and the things we don't. And then going through some really big personal experiences where I was like, okay, at this point, I have to talk about it. So where do I go? Who do I go to? Like, how does this work? And there wasn't really much of a roadmap. I feel like there is for most things in life. And then I found myself in grad school, and there were very few classes you can choose in the Master's of Social Work program. It's pretty highly regulated. And so my electives, there was the whole certificate in palliative care. And so I was like super curious, and like, I'm doing it. I'm doing the certificate. I'm taking all my electives in it. And even my peers in grad school were like, ew, kind of, like, why would you? They were uncomfortable with that idea. You could take all these other ones. Why that? And then I really thought, okay, if people who are passionate and dedicated and committed to this work are also uncomfortable, this is a big deal. And then, of course, the electives themselves were really eye-opening and wonderful. And just reiterated that you can do this work. It's needed. It's important.
Yeah, well, it makes a lot of sense. I think, especially when we have our own experiences, it leads us to sometimes just be more curious about what is that. If I'm struggling with something or if I'm having this experience, it fosters this more natural curiosity about it. But that's really striking to hear that even people who are in similar training, similar care for, I want to help people, I want to learn how to counsel or support people in different life situations. And yet the ideas around grief make people uncomfortable. And you said palliative care. Can you talk a little bit about more specifically what that is?
Yeah, a standard set and approach to a school of thought around talking to people about end of life, what goes into it, kind of normalizing it, and really trying to empower them to have their own voice over life. There's a lot happening you can't control right now, and it's pretty terrible, but here are some things you can. And let's really be intentional around talking about, having conversations about, maybe helping foster conversations in your own family, because it might be hard to have a conversation with this with a spouse, right? Oh, well, me dying makes them feel anxious, so I can't
Yeah.
talk to them about it. So that would be my like, it's just helping empower people around what they can't control. And it's usually focused around something that's chronic, or a lot of times like life limiting or life ending circumstances.
Yeah, and in that situation, I can just hear when you bring up a lack of control. There's so much going on that someone doesn't want to experience, is struggling to accept or work through, and then there's this whole other concept of end of life. I mean, it's not separate from that, but I
Mhm.
hear you offering almost a sense of control that we actually can think about this. We can prepare, we can talk about it, we can begin to process some of these feelings. So it's interesting to bring that in, even though, of course, it's going to bring up a lot of discomfort and
Mhm.
feeling. Yeah.
Yeah.
Well, I'm curious if we could start with Why is it so uncomfortable? You're stating
Yeah.
it is uncomfortable, but what are your thoughts around why that is?
I have a lot of thoughts. I think it's not uncomfortable for all people. It's not uncomfortable for all cultures. So I think a big sort of macro component is just the way our culture and society approaches death and dying and the grief that results for people in that. And sometimes grief that results in other things too. But we really like to focus on anti-aging, young and youth and celebrate youth. And I don't think that there's anything wrong inherently with like celebrating that. But it's so amazing to me how many similarities there are between birth and death. It's very striking. And we're really good at celebrating one and being
Mm.
excited, normalizing the excitement around one. And then we just sort of, as a society, kind of just, avoid. We're just like, oh, I don't really know how to do that or what to say, or, so I'll just do nothing. And it really makes something that's already extremely isolating and painful and heavy that much more isolating, painful, and heavy for people because they don't want to make people uncomfortable, right? And then they feel sort of paralyzed too. I don't even know what to do with this, and it's happening to me or it's happening to my loved one.
Yeah. I like that comparison between birth and dying because in my mind, I'm seeing this draw towards birth, just a lot of people coming around, like in a hospital room or showering with gifts and love and flowers and all of that. There's a similar image with something at like, let's say a funeral or a similar dying event. And yet there is more of that pushing away instead of a drawing near and a bringing
Mhm.
together of people. I really see that pushing away or avoidance of this is too much, uncomfortable. I don't know how to do it right. So maybe I'll just stay away from it.
Yeah, and I mean, that's my big macro level one where I think that we can certainly do a lot better. And we have examples of other cultures in the world that do a lot better. But I feel like on a smaller scale, even parents, right? Like I have other therapists who are friends who are like, I don't know what to tell my kids about this relative who's dying. And I'm like, you talk to them about all kinds of hard stuff and uncomfortable things. This doesn't have to be that.
Mm.
And you're allowed to like have your own feelings as a parent, and your kids can see that, right? To a degree. So I'm thinking like, okay, everyone's gathering at the hospital. You might even bring like your older children with you or something. And then I hear even from professionals, a lot of, oh, I don't know. I don't know if I can bring my kid around. I don't know.
Mm.
What if they have nightmares? Right? So all their own fears and anxieties start coming in. And it's, you didn't think twice about last week when your sister had her baby. It feels deeply entrenched, right? And I'm like, it's okay. I mean, obviously the circumstances depend on, right? But if it's a very peaceful, just like the circumstances be dependent around a birth, but if there's something traumatic happening, right? Having them feel included in the process actually ends up answering a lot of questions.
Yeah.
Uh, but yeah, I've always found that interesting too. I'm like, wow, like it's immensely uncomfortable. And I think another part is probably just like the finality and the permanency of it, right? And then like, how do I answer those questions? And then, of course, existential, right? I don't want to talk to, what if they don't believe the same thing happens after life that I do? Or what if I don't know what happens and I just want to live my life avoiding that I don't know? It triggers that. It triggers your own thoughts of your own mortality. So it's like this giant mirror sometimes, I think, too, which is what can make people feel really uncomfortable. Like, I'd rather not. I'd rather just do the things, like, even though I know they're dysfunctional, but they're familiar. So I'll just keep doing them.
Yeah, we have such a script for them. That's what we see, and it's just easier to mimic that or copy that again and again. I'm curious, I like that you brought up the piece about it doesn't have to be traumatic or there's a context around it. Obviously, any kind of loss can bring up intensity of feelings and the way our body or minds experience that can still feel traumatic. And yet, I'm hearing you say that in a normalizing way, there can be a lot of it doesn't have to lead to nightmares. It doesn't have to lead to struggle around it. Can you say more about that?
Yeah. Eventually, I think I'll go back to my professional work. So I'm in grad school. I'm super interested. I do all these things. And I find myself in some different roles professionally, but I've always was like drawn to that. And so when I finally find my way back to that, I worked as a full-time hospice social worker for a number of years. And I did a little bit of home health right before that. So I've been with a lot of people, a lot of individuals, a lot of families around end of life. seen a lot of things, experienced a lot of things that way. And it was just such an honor. And they were all peaceful. I mean, the actual I'm in the final stages of dying were peaceful. And maybe that would just happen to be my set of patients that I worked with all those years and my experience. But were there certainly like circumstances and things outside of the the actual death that were peaceful? Yeah, of course. But those were usually in existence before we added that element to the context for those families or individuals. But yeah, it is interesting. It's interesting how much like birth, it can really bring people together. People chosen to not interact it for a long time. Sometimes people are like taking shifts, right? So they move it to their mom's home or something. And it does. It feels like really unique time as an adult that you're getting with your loved one that you wouldn't normally get. And so yeah, I think there could be some really special elements. And yeah, my like overarching theme of all my experiences that it really was peaceful.
And that's a lot of experience. And I hear you saying it's not always the case. And yet having that be an option. And as you're saying that, I was thinking too, there's so many just life events or life stressors that we experience, and people are just going to experience them differently. Something might happen to someone, and it is just going to feel differently than someone else, and it doesn't always have to bring on the stress. How about people who might feel like they're doing it wrong or aren't sure what to feel, all those unknowns or the existential piece that you brought up? Maybe they don't feel sad or they feel something that they didn't expect to feel.
Yeah, I think that's a good one to bring up and to talk about. I end up to see a lot of Greek clients. I end up talking about this. Like they're like, well, I'm really nervous or uncomfortable to say this, and I feel like this might be the most appropriate place to say this. And so then I didn't miss them. I didn't cry. I don't want to go to the funeral. And or the other one, I feel relieved, Rachel. Like I feel, oh, right, I'm not staying up around the clock for weeks on end at my mom's house, and I can get back to managing my own house. And there's this relief component. I feel that's icky. I'm not allowed to feel that way. But in reality, anyone who's been through that experience, end of life with anyone has probably felt similar things. And it's okay, right? To not miss people. The people you're going to miss are the people you had like attachments to and who put in intentionality and effort into being a part of your life and helping you feel seen and heard. Those are going to be the people that you really miss their presence. And I think it's not only like important, but also just genuinely like really healthy to be honest about, because what ends up inevitably coming out was like, well, this person was kind of awful to me.
Mm.
And I'm like, well, that's actually healthy. You don't miss that. We'd be
Mhm.
having a completely different conversation right now. As a therapist would find if you were like,
Yes.
well, this person was really awful to me, but I really wish they were here. It sort of fits logic. I mean, it makes sense why. I mean, and it's okay, right? Again, it comes back to that, oh, well, I don't think people, I can't say that moms come out a lot. I mean, parents, but especially moms, that mother wound. Yeah, I don't miss my mom. So how do I tell people that? Do I not? And I'm like, of course, if you want to, of course. Like their discomfort is not your issue, right? And if
Mm.
they really want to see you and know you, they're going to want you to open up and want you to feel comfortable and trying to help you understand why and helping you help them understand why as well.
Yeah, so much more than just faking it or creating a feeling of because I feel like I should feel this, I'm going to act that way. But if that's not true, I think that would cause more issues down the line.
Mhm. Yeah, yeah. There's actually a really good book I read a few months ago. Jeanette McCurdy. She was like a childhood actress. And then
Something about I don't miss my mom or I
the
happy
title, which yeah, I was like, that's ballsy. And I think I love the book already. And of course I did. But it's called I'm Glad My Mom Died. And she was like a picture of her like holding an urn. I mean, right? Talk about brave. And then she's this incredibly talented writer and obviously makes a really compelling sort of tapestry around like how she got there, right? Sort of draws you in. And it does. It makes sense. By the end, you're like, yeah, that'd be like not healthy if you missed that.
Yeah.
Yeah.
And you said a couple of times like cultures handle grief differently, but I'm just thinking I haven't read the book, but what a really good description or depiction of this is a way to experience this life event. Based on her experiences with her mom, this is how it would be okay to follow that path, just like any other path might make sense. And it also sounds like there could be just a lot of variations. It's not gonna be only happy that my mom is dead, or only sad that my
Mhm,
mom is dead. I think that there's
mhm.
room to feel mixed about it and maybe go through seasons of feeling different things at different times.
Totally, right? Because that's what we would say and normalize about many other human experiences too. We just want to like include
Mm,
grief. But yeah, of course, that makes sense. Even in her book, there are things she liked about her mom, right? She's probably going to miss those things. Yeah.
Well, where do we go from this? What's a way of thinking about this, maybe supporting each other? Where do you wanna go next?
I think it's getting better. I think on a massive scale, it's getting much better in our society. I think we are. I think we're funding like grief research more.
Mm,
We're taking some nods from other countries who are way further along in that kind of research, which is amazing. I think we're more open to having a lot of those conversations. So I think just being intentional, committed to be part of that, reflection on your own discomfort. What about death or dying or existential things or any part of what we talked about, right? What about that makes me uncomfortable? And how can I work on that to show up better for the people
mm,
around me? If you're a therapist for your clients, right?
mhm,
If you're human, even just for yourself. Certainly as a parent, being able to model and the things you're wanting to show for your kids in that way. I think it sort of sounds like sometimes in my head, a drop in the bucket. Oh, but I actually think it's probably more than a drop. That sort of change, like in a more grassroots way, I think can be a tangible place to start for most of us
yeah,
if we're honest, right? Okay, I listen to a podcast. I'm like, now what do I do with this? You know, with a lot of time or right. It takes time to integrate things to change behaviorally. So I think starting small like that would be helpful anyways. And then I think about the people in your life, think about the people who are experiencing grief, who are facing the end of life or death or dying.
mm,
And it could look a lot of different ways, right? It could be like a mom who just miscarried. It could be a pet. It could be a job. It could be like grief has a lot of even in parenting, like the loss of your dreams for your kiddo. If you spend a
mm,
long time dreaming about things for your kid and then other things happen.
mhm.
So think about the people in your life who are grieving and do your best to show up for them in a more open, I'm here to witness your pain and be in the trenches with you sort of way, rather than I'm showing up with my own discomfort kind of energy around you.
Yeah, which would then cut off space from them to feel what they're feeling. And yeah, I think that's so important. I think the more that we are able to reflect on how we feel about anything, but especially with grief and sit with all the stuff that you're talking about, I think it just creates all this room then. We have room for ourselves, we have room for someone else's experience. It doesn't have to feel the same as ours, but we've had that experience of being curious and being open. And so I think it then allows for in a relationship there to be like we're holding this together where I'm
Mhm,
able to ask you, how do you actually feel? And I want to know. It's not that I'm trying to say, oh, but don't say that because I don't want to hear that or that's going to make
mhm.
me uncomfortable in some way.
Yeah, and I feel like that's the good stuff in life, right? Like those are the things that connect us as humans. Right? And we're like so wired to connect. That feels amazing. It might sound like a small moment, but for most of us, if we're honest, that's what we want in any relationship, like a romantic relationship with our kids, coworkers, anything. I think Esther Perel has said it before. There's nothing sexier than feeling seen and heard. And she's right. That's amazing and never gets old. Turns out. And particularly with something as heavy and isolating as this, I always think about it as you're in a desert and someone just like gave you a sip of water. It's massive.
What is grief? Do you have a working definition that we can?
I should have consulted Google. That would have been a good preparation for this. So I think about it when I was saying earlier in a broad sense, right? Someone's experienced, I associate it with loss, right? Someone's experienced a loss. And grief is sort of this process that we see happen after of making sense of it. Sometimes part of making sense of it is like magical thinking, right? Kind of more like an avoidance route. But essentially, there's a loss and then this process that happens after. But most people, I think, it's not a process that has a finish line per
Mm,
se, right? It's not, I'm going to do these 7 steps and then, ta-da, I'm going to feel a certain way. I don't think there's many things in life that are like actually can truly offer that anyways. But yeah, so by process, I really think circular what you were saying earlier. Sometimes you're like, you're killing it, you're just nailing it. I just got it all under control. It's great. And then the cycle sort of continues. And then you're like, okay, don't have anything under control. And I'm not doing great at all. And it's so hard today or in this moment.
I think that's a really important distinction that it's both a feeling state, like grief is a feeling and it's also a process.
Mhm.
And yeah, the circular nature of that, it can be so overwhelming when you can think, well, I've already felt this. I've already had this thought before. I've already missed my mom at Christmas. This is now the second or third Christmas. Why do I still miss her in the same way? But I think coming back to a round of thinking, well, I still always have feelings. We always feel emotions in different ways in different situations. But then also, as we're changing, it might be processed differently in different seasons. And we might need to really intentionally come back to that piece of grief work and think, okay, well, how is this sitting with me now that I've grown or done something or moved or something? It might be situating somewhere different inside of us.
Yes, I see that all the time. Yeah, I've had clients over the years where they start out as grief clients, feel like that's under control, want to transition to talk about other things and working on other things, think that we do that. But it's still there sometimes subtly, sometimes overtly, the line checking in on it. And yeah, I mean, it definitely comes up. And you talked about Christmas. Yeah, I think that's a huge one for a lot of people where we think about major milestones, Mother's Day, Father's Day, birthdays, death days, diagnosis days. Yeah, it's all in there for people. And
Mhm.
some people get more attached to some of those things than others. But I have seen holidays sort of, even though they're obvious, be sneaky for people who are
Mhm.
grieving, right? Oh, yeah, I'm great. And I'm like, well, Mother's Day is coming up. Are you sure you don't want to check in about like how you're going to take good care of yourself through that? Or, oh, no, I think I got it. And then woke up and it was really hard. Right? And watching everyone else hang out with their mom that day and
Yeah.
seeing social media about all these things about moms, then I'm just alone.
Yeah. You touched a little bit right there on diagnosis day, which I think for so many people can be connected to sickness or illness that leads to death. It can also lead to more of a chronic illness and then the grief that comes along with that. I don't want to move too quickly away from loss of life or
Mhm.
pain, but I wonder if you can speak a little bit to the grief that comes from more of the chronic issues or loss. I think it's called more like ambiguous loss, where it's not necessarily a
Mhm.
person who is gone, but it's a life situation that has changed.
Yeah, definitely. So chronic health issues also are isolating in their own sort of like overwhelming way. And I think much more like intensely so since COVID, right? There's people who live with all kinds of things like immune deficiency, all kinds of things where it's like this virus or well, viruses have way bigger impacts than most of people walking around with like their privilege of wellness don't have any concept of. And so I just say that to highlight it is it's incredibly isolating and then even if you do have the ability to get out, do things you like to do, connect with the people who you care about and love, it often gets in the way and there can be flare-ups depending on the situation diagnosis. So it's this, I was thinking about it as this incredibly painful kind of like almost begins to feel like this hamster wheel you're on where you're always adjusting your expectations. Just, you can never just get a day that goes the way that you were hoping. It's just over and over. And I've really seen it over all these years is like this battle between the brain and the body, where it's like your mind is in one place and then your body can feel like it's like holding you back. And so getting those two to be in alignment can be really hard because there's a lot of grief there. Right?
Yes.
Well, if I really come to terms with what my body is actually capable of and where it's at, and then I'm going to be really sad, Rachel. I'm like, yeah, you already are really sad. We're just not spending a lot of time being in touch with it.
That seems like a really important point that it's not that by pressing into the grief of it, processing it, it's not making it bigger. It's just uncovering what's already there. Maybe
Mhm.
it makes it bigger in a way that you're feeling it now. You're having to actually hold it. But yeah, that feels like a really important point to note. It's there, it's under the surface, even if you're not thinking or talking about it.
Yeah, and it's right. That's what we're doing with clients about a lot of different topics. And so I hear from other colleagues, oh, what you do, I could never do, right? We talk to people about cancer all the time. And I'm like, no, you really could do it. You do the work. You just do it in a context that is more comfortable for you than you feel like you're a little more in the flow and in the zone and stuff. And it's hopefully something you enjoy, right? Like you enjoy supporting the science you support. And so I think about that on the flip side too, when I'm like, oh my goodness, this therapist or clinicians doing things I could never. And I'm like, yeah, no, I probably could. It's the
Mhm.
same set of skills, I think, for the most part. I think the other thing to talk about with chronic illness is that we're talking about it in this broad category, right? There could be lots of things that are chronic, but I think by virtue of that word, there is definitely going to be some grief and loss there. And
Mm.
again, and people process things in different ways. As far as like how to support people, I think another big tool is you just ask, right? You just ask, like, how can I help? Oh, there's something you could do that it's for asking. I don't, you could like never ask again because I don't like talking about it. That might be
Mm.
an answer here. I'm like, oh, okay. But they're still walking away, even if that felt salty, right? They're still walking away knowing she cares or they care. He does.
Yeah.
Even though I might not admit it, that probably felt a little bit good there.
And if they feel differently, then you might be someone that they'd come back to and say, "Hey, I now am wanting to talk about it," or "I did think of a thing that you could help me with." So there's especially with chronic, how it's chronic. So there's going to be either a lifetime of it or just a really long years ahead of iterations of the experience. And so you might
Mhm.
come around. It's reminding me, I actually don't know if I shared this with you, but right during COVID, I was diagnosed with breast cancer and went through treatment, have come out of it and kind of in a really good place with health, but continuing to do the like preventative care for recurrence. And one of the my experiences of grief with that is I think you mentioned this more about parenting with the loss of what was it? Dreams for your children, the
Mhm.
different like what I imagine. I think that was one of the things I experienced with the complexity of something like chronic or the age that I got diagnosed or where my life trajectory was going and having to sit yourself and this is my life now. These are my experiences. How do I open myself up to what I'm feeling about it, but then also renegotiating with myself whether how your body is feeling, whether what years you're living. At a recent appointment where the age for me was one of the things. Getting cancer at such a young age combines like, well, youth and health and all that goes along with that.
Mhm.
So having to kind of renegotiate that, I think has been a really challenging, obviously, process, but it speaks to that again, iterations of grief. I might be feeling fine about, or not fine, but have processed through the generality of this experience that this thing has happened, or I'm working through it. And then kind of a sneaky little, oh, and that too, or that changes
Mhm.
this part of your life or your future. Any
Mhm.
thoughts about how to either sit with that or talk to people about that if that might be a part of the complexity with more chronic issues?
Yeah, I think for a lot of people with cancer in particular, I have a lot of experience with that. We can also see some PTSD, some trauma things come out of it. And I think some people are like, what's grief? Right? Or I guess is a lot like, what's grief? What's depression? Or what's grief? And there can be a lot of overlap for sure. I think it's a nuanced question. So there's probably a much like more eloquent, like nuanced answer. But I trying to like keep it simple and easy is I think about it a lot more. Okay, if someone has depression, right, we have the criteria for that. We see it. You could have something else at the same time. So let's just assume if they've gone through a loss that grief is on top of it. And there is a thing called like complicated grief or the type of grief. I'd say the other thing with depression and more like chronic mental health conditions is that with grief, we can see, again, not a resolution, not a, like that circular process. It's like, now you're completely checked. But clients come like reporting, I feel equipped, right? Like you've helped me feel equipped. I can handle them better when they come. I can, right? Like they feel like they're doing pretty good. And a depressed client isn't going to become insane. And
Mhm.
so sometimes we get a time and you just see like how someone's handling it. But there's a really like specific part around the complicated grief part where there you often see like this intense yearning that just
Mm,
doesn't lessen or doesn't ever go back and forth either. It's just this
mm,
constant, intense, very intense yearning. So that sometimes is really helpful to the okay, there's more going on here probably
mhm,
than I don't want to say standard, but what we know about grief and the grieving process. This is a sign that someone might need something more. But when we think about your experience, I always think a lot too about someone's relationship with their body at that point.
Yeah.
And there's some trauma there. Not all clients really like that word, right? But they all talk about it does. It feels like there's like a sense of betrayal is what I hear a lot. Different people have different, some people are like really big into wellness and health and are like, I did all the things and it didn't get me what I wanted. So there's a lot to process there. I think the expectations that you highlighted are probably the hardest, right? Because then you're thinking like, okay, I don't know, these are just the things that pop in my mind. Like, am I going to be able to breastfeed someday? And there's so many things that go in with breast cancer, right? Like, do I want a reconstruction? Do I want nipples? Do I not? Like all these things you never had to prepare yourself to think about. You're forced to suddenly, and then maybe you get them and you're like, okay, I didn't actually want that. Is there now? I don't know. Right. It's so many unknowns. You didn't know before the diagnosis, like how great life was just walking through life. So maybe more naively or a little more in the dark about what happens for people all the time. Every
Mhm.
day, someone's going through something like this. So I think learning to give yourself a little bit of self validation of this is hard and a check in is this reasonable? Is what I'm feeling reasonable? Of course,
Mhm.
I'd be sad that I'm not going to get to go on vacation and wear the things that I would normally want to wear, right? I get to be sad about that's okay, right? Or of course, I'm sad that I'm breastfeeding now, but it feels different than I always thought it would because I have these implants or something for me now, right? Maybe there's some loss there, but just validating that for yourself.
Yeah.
That's hard. You get to feel that way. That's okay. I think it's huge. And I think really thinking about cultivating addressing that betrayal piece, cultivating a really big sense of, I don't know what do I want to say, just yeah, I want to say healthy, meaningful. I think that's what I'm looking for. Like, how do I create a more like meaningful connection with my body? Because we've been through a lot, right? You can be like, okay, we've been through a lot. Let me just check in and really nurture this relationship here, which doesn't always right. It would probably seem very obvious if this was like a human in your life that you would do that. You'd show up in that way of, oh, I just want to check in and I know things have been hard, right? But it can feel different and a little bit more strange with ourselves, but it's
Yeah.
huge.
And I love that you're bringing up even the word, something like reasonable, or when you're talking about longing, and is it unreasonable? Is there a way it's starting to get, I don't know, I think of like sticky or something like that? I think those can be judgmental words that we have to be cautious about sometimes. But I think it also, thinking about what could be normative, and there's a huge range of normative, but part of that can be the validation of like, it's understandable that I'm feeling this way. I don't always have to be okay. I don't always have to feel contented or seeing the silver lining. It's reasonable for me to feel sad in the situation. And also that check in, the reality check, maybe at times of, I know I'm sad and it's okay that I'm sad, but I think I'm stuck here. I think that I'm feeling this intensity and it's not really changing. I'm not able to think differently about it. Timelines I don't think really match for anybody, but maybe you've been here longer than you want to be and it seems, yeah, this is probably longer than it has to be. Not saying that you're gonna feel completely fine or you should ever feel back to normal, but I'm glad that you're bringing up those words because I think that those can be things that people can feel uncertain how to judge for themselves, and really good things to consider, and then maybe bring to a professional to ask
Yeah.
them, like, "Where do you think I'm at with this?"
Totally. Yeah. As I was going to say, I think those are really good, like, choice points for people where if I'm here, why not? Maybe why not ask a professional for some support? Maybe why not attend that support group that I've kind of
Mm,
been putting off? And because then I'm going to get some feedback from other people, right? That'll tell me a lot too. And I can ask
yeah,
them if I want it, right? Yeah. Where you feel empowered, right? To listen to your own instincts about yourself and your self expertise.
yeah,
Will be
yeah.
huge.
Well, I'm curious if there's anything else you want to say about chronic illness or complex grief, something like that. I have some questions about death, but anything there that we haven't said
Okay.
yet?
Maybe I'll just say something real quick about complex grief. Yeah. So complex grief can feel, even as a clinician, having training and experience and expertise in this can sometimes feel intense for me too.
Mm,
I mean, it's just heartbreaking, right? It's like you're witnessing firsthand this pain and you're trying to help them carry it. And it can be really difficult. I think it can be really helpful at that point to talk to other professionals, right? A little more like
Mhm.
care coordination, prioritizing that for that client or patient. And really, sometimes it feels like a little more like motivational interviewing techniques, stuff like that, but really honing in on what is it that they are willing to do around like taking good care of themselves. Cause the complex grief can sometimes it's just like all they can focus on is the yearning. There is nothing beyond this. This is my life now. And so as a clinician, helping them find ways to see it's not, but it really feels like it is. And
Yeah.
so how do we help you help yourself here and getting to even just an ever so slightly better place? And better meaning like you feel like slightly more equipped, essentially is the way I would look at it. But it's hard. It's hard and messy and difficult and confusing. And for the person experiencing it and the people treating it, it's hard.
Well, and I hear in that too that it doesn't mean that you have to punish yourself in the feelings. Stay unhappy or stay in grief. In some ways, quote unquote, like unnecessarily. You can experience joy alongside of that. You can have hope. Like there are some things to create some movement. And it seems like with what you're saying, there are so many people in that situation that can't see that and might need someone else to open up the space around that.
Yeah, for sure. And I think even outside of complex grief, like for all of us, like even what you were sharing too with what you've been through and like how do I constantly and sort of consistently keep adjusting expectations I didn't even know I had until they're just right there in front of me. And
Right.
right, maybe it even caught me off guard. But thinking about it in the sense of two things, three things, so many things can be true at the same time, right? Which is a huge gift. Therapists often end up giving their clients, or when it's like, oh, it is, right? So it's okay that I don't miss my mom, and then sometimes I do. Yeah,
Mm,
it's okay that I'm at the end of the road with my life, and I feel like peace and want to go, but I also really don't. Yeah, that's okay. And like any other version of all of this we could come up with, but yeah, it's okay to be grieving and feel tremendously sad, and then have moments of happiness and joy, and that's
mhm.
that is the human experience. And it's confusing. It's real confusing. I
Yeah.
feel like it's confusing for me and I know all this stuff. So then I think, wow, it's rough. The mind can be a rough place sometimes. You could preemptively set the stage for yourself or people you love or people you care about in a healthy way. I think that can be really helpful.
Yeah. Yeah, I think again about just modeling, like, so many people maybe just never hearing that, like what you just said,
Mhm.
like, you can feel multiple things at once. If you've been in a family where that's not been taught or never modeled for you, and you start to have an experience and you don't know if it's okay or normal or healthy or if you're just weird or doing it wrong. So, I love that you're creating, again, this modeling of so many different ways of being with it.
Yeah. Oh, yeah. It totally blew my mind the first time I heard. I was in grad school. I went to my own therapy and I was like, hold on. This feels like a big deal. Yeah. Turns out it is. Yeah.
Yeah. Well, maybe as we wrap up, is there anything else specifically with the death of our loved ones or our own death? It's a reality that everyone has to think about at some point, if not for your entirety of your life. What are some ways of building some self-awareness around that, thinking about it, tolerating some of the feelings that come up from that? Do you have any thoughts there?
Yeah. So what I was saying earlier, right? What about this makes me uncomfortable and why? I think would be really helpful. And then if it leads you down a route where this feels really big, again, like how do I get support with it then? Not feeling like you still have to wrestle with it on your own. But yeah, I think it all starts with yourself, right? Start having conversations with yourself. Oh, what kind of funeral would I want? Do I want a funeral? What do I hope my end of life experience is even like? And that can be hard to fathom if you've never been with anyone else at end of life, right? If there's nothing to compare it to. You could think of any sort of prompt. What do I hope the people around me feel from that experience? Or I think about it a lot too, being able to give gifts to our loved ones. And I think some big gifts that we can, again, have to start with ourselves and our own self reflection. Here's all the things that I want and that I, like, maybe important things that I don't want. And I'm not going to be here. And you're going to be going through a lot. You're going to have a lot of different emotions, might be really exhausted and tired. There's just likely to be a lot going on, as there often is at ends of life, similar to birth, right? That correlation again. But if I can't take anything off of your plate, right? It's like in the middle of your grief, you're not having to figure out like does Rachel want to be cremated or embalmed? I would love to have taken that off of your plate.
Mm.
And what we see with the grieving people, the people left behind too, is it really gives them the sense of peace. We honored, we did all the things they wanted, right? We didn't have to get and then live with that. I don't know, was that the right thing? Is the part of their grief? So I think that's a big thing people can do is start to have the conversations with yourself. And I don't think you need to get to a place like you don't have to be like me. You don't have to be like excited to get on a podcast to talk about death. Okay. But that's just my quirkiness. But you certainly get to a place where you can tolerate the discomfort in a way that feels healthy. Right. So
Mhm.
it's not so uncomfortable that then you need to engage in avoidance. And part of the how, because I know you have the how, I think just small digestible, just start, okay, well, that feels like too much now. Okay, there you go. That's more information than you had before. That's
Mhm.
where you're kind of working right now. You're hanging out. You'll know when you're ready for a bit more. Or again, right? Because know a lot about themselves. You might be a person who's I don't feel it's realistic that I will ever get to a place where okay, comfortable. Then let's talk to someone. Let's get you some help.
Mhm.
It's not like it needs to happen overnight or in a year or 10 years, but there's something there, right? There's something like fear oriented there that is pretty big that you could probably use some help unpacking. Yeah. So I think having clear wishes, again, the palliative care part of me, it's really thinking about even all the other clear legal stuff.
Mm.
That can also be such a gift to your grieving loved ones. And
Mhm.
not having to go to probate court or this court or that, really being intentional about that.
Well, and all those logistics too, I'm really glad you're bringing that up because I think so in this conversation, we're talking so much about emotion or like the relationship, but there are so many logistics that are happening in this process. And
Yeah.
to have the privilege and the foresight to be able to prep for that and not have to pass that on during this time of grief. I'm also thinking that you might be a little bit more clear-headed if you're able to make some of these decisions when the intensity of grief is not intermixed with it, but rather this almost like hypothetical grief or just the existential
Mhm.
feelings about it. You might, yeah, have more ability to think critically about those things.
Totally. And like the bandwidth and maybe even the motivation to do so because you don't have these other massive things on your plate. Yeah, that's a good
Right.
point.
Yeah. Yeah. Or the cognitive decline, if we're talking about different either medical issues or age, where at the end of life, you might not have the capacity to make those decisions. So doing it when you're well enough to think about it can be that gift. I like that, the framing a gift to your loved ones.
Yeah. Yeah. I mean, because I've been on both sides for so long with talking to the person experiencing it and the people. And it always comes back to that where it's a real way to honor that relationship. This is really how I think about it because yeah, it's overwhelming as a caregiver, right? It's
Mhm.
overwhelming as someone experiencing a significant medical diagnosis, whatever that may be. And yeah, it really honors that relationship, right? And that there's trust there. That you love me so much, I know that you're going to honor. And I love you so much, I don't want you to have to deal with this on top of all these
Mhm.
other things that are going to be happening. It's not a parking lot, but it becomes this big support where it's like, again, so much happening you can't control. These are the things you can't control, and you get great. You honor your relationship with your loved one. And then on the flip side, there's so many what ifs, right? So much stress. Maybe they already had a stressful life before all of this sort of came into it. And it's okay, I have a roadmap. Right? I have a way to really help them control what they can control. And we all can kind of get behind that and feel good about it. As good, I mean, as good
Mhm.
as you can, maybe not like good overall, but
Yeah. Well, and as you say that, I'm realizing we haven't really talked about the suddenness that sometimes death just happens. It's not, there's no
Mhm.
preparation. So, similar, that'll be outside of what we can talk about today, but to know that to do this prep work ahead of time, it might help in the suddenness where you had no idea this was coming and your family didn't
Mhm.
either. And then there might be just this aid in that process if there's resources available. Well, there's so much more to talk about, but I think this is a really good overview. Is there any final thoughts that you have?
No, I mean, thank you for having me. I'm happy to be a part of this conversation. I'm happy it's happening. I hope it spurs other people on to have these conversations with themselves and their loved ones and not to have a fear orientation with it as much as we
Yeah.
can.
Yeah, definitely. Thank you for the resources too. If there's anything else that we can talk offline, if you want to include in the show notes, I'll be sure to add that in. Well, thank you again. It was a pleasure to talk to you about this.
Yes, you too. Thank you.
Relational Psych is a mental health group practice providing depth oriented psychotherapy and psychological testing in person in Seattle and online in Washington State. If you're interested in mental health care for yourself or a family member, please reach out. Our website is relationalpsych.group.